So welcome back, everyone. We're still live on Facebook, so I want to say hi to everybody out there. And I am very excited about bringing on my next guests. They've been on with me once before. I have with me Scott Woofenden, if I said that correctly.
That's right.
He's the owner of ePain. He also has with him Jason Chapman, who is the attorney also with ePain. Welcome to the show. Please tell everybody a little bit about yourselves and what you do.
Well, thanks for having us, Carol. ePain is a medical practice that specializes in helping patients with chronic pain. The management of chronic pain is multimodal, meaning it has a lot of different aspects to it, whether it be surgical, injections, physical therapies, psychological therapies, those kind of things. ePain plays a role in the medication or the management of those medications involved with chronic pain.
Well, let's also talk a little bit about some of the things that when we talk about chronic pain, why you're here, why you also are here. There's a reason for it. So let's talk a little bit about that, Jason. So tell everybody a little bit why you're here with him.
So a year or so ago, the Arizona developed a law that kind of governs this area of treatment, specifically treatment that involves chronic pain, treating chronic pain with opioids. And that follows some federal guidelines that came out actually in 2014, and then they were revised a little bit in 2018. Well, as an attorney, I help the providers at ePain kind of navigate through the state law and also the federal guidelines. When
you were here the last time, if I remember correctly, what we talked a little bit about too was that there is a place sometimes for this opioids, right? I mean, a lot of people have their thoughts about it, and there's a lot of doctors out there that did some things. I think that maybe did write some scripts, maybe. I don't know. But I do know that you use it for pain, but not necessarily that you're just giving it out freely, correct?
Right. There's a lot of inappropriate uses of this medication. The appropriate use is to properly identify patients with the conditions that would indicate it, with patients that have tried and failed other things that have not worked, and with patients whose functional limitations and quality of life is so impaired that they may need this to have to be more functional.
So let's have an example of that person.
Sure.
Who would that person be?
Sure, it would be the person who had an injury in high school, hurt their knee. As they grew older, they developed arthritis. They attempted injections. They tried physical therapies. They tried over-the-counter medications. They even went to their orthopedist and had some surgery done. And despite their efforts to manage the pain related to that condition, they continue to have it. At that point, to allow this patient to potentially walk, to potentially have a job, to potentially interact with friends and family, we would use this medication.
Now, when you also work with people, you do telemedicine where you can actually talk to them by phone and find out a little bit more about them and find out whether they're the right candidate for this, correct?
Yeah, in the last few years, the technology and the regulations have improved to the point where we can utilize this to make treatment more convenient, especially for this patient population who oftentimes has trouble getting out and about.
Now, the phone number to call them, it's 480-559-3149. Their website is e-pain.net, and they're located right in Mesa and Alma School at Baseline as well, right?
Baseline and Alma
School. And they work statewide with people, so they have people that also drive from far away to come in to see you. Is that correct?
Yeah, the nice thing about telemedicine is it does allow us to reach a broader population. Regulations require that we do have them come in office initially, but after establishing that relationship, they have the option to see us from their home.
Now, you have a free phone conversation that you do with them. It's a free consultation on the phone, and then they also will do a follow-up with you via video conference. So they're going to go back and go over that, everything that you talk about. Then you also go back and talk to them again?
Yeah, we don't want to waste people's time, so oftentimes we'll have that initial conversation over the phone to find out whether they meet the criteria for this type of treatment.
So, okay, what common medications are used to treat pain in general?
The most common are the over-the-counter anti-inflammatories and Tylenol. That's usually what people start with when they have pain. We use muscle relaxants, and we have some neuropathic type medications that also manage pain. The most potent, obviously, and oftentimes effective is the opioids.
When somebody needs that, at what level? Okay, I'm going to say this. Like if I was you came to me and I was a doctor. Okay, what level is your pain? Is it from a 1 to a 10? What level is your pain?
This is really Jason's topic.
Isn't that kind of funny that I did that way? I just came up with it.
Yeah, we actually don't focus as much on pain level as we do on function now, as we try to look at what are you able to do and not do because of your pain, rather than what level of pain you're in. And so that tends to be the focus with the patients that we treat. So
if somebody's telling you, I cannot it's hard for me to walk now, I can't hike anymore, I can't walk, what are the different ones that you might say where they would say that to you, where you'd say, I think you might need something a little bit more right now?
Right, it's the patient who is unable to work, it's the patient who is unable to ambulate functional distances, it's the patient who is unable to take care of themselves, whether it be showering, bathing, those kind of things, because of the pain that they have. I
know a lot of people like that. A lot of people are like that, and it's sad. And I'm not sure some of them if they feel confident about, because they hear so much about the negativity now of this drug, right? But you're here to talk about the fact that there is a positive side to it.
Right. I think this drug can be effective and safe when it's appropriately prescribed, when the patients are appropriately screened. It's oftentimes when we identify the wrong patient or we don't monitor that patient appropriately that these can become dangerous for people.
So let's talk about a safe pain medicine. Which ones are they?
So, to determine a safe one, usually they have to have the right diagnosis. A lot of times we get in trouble because we give this medication to people that don't have the right kind of problems. Then we have to monitor them appropriately, meaning, once they start this medication, we have to properly make sure that they're taking it right, that they're not taking anything else. So we do drug screens, we monitor their medications, we check their pharmacy regularly to make sure who and where they're filling their medications. So usually this becomes a lower risk process when the proper screening is done and when the proper monitoring is done.
So you handle that your office actually goes that far to make sure that they're not taking it inappropriately.
That's right. That's one of our biggest jobs, is to properly identify the patient, the right kind of patient, and then to monitor them once we do.
So let's say if they lead to an addiction, okay, and maybe even death, right? Why would you want to use an opioid, if I say it right, to treat pain?
The best answer is they work for many patients, but they do have risks, and so we have to be cognizant of that. But we're looking at their function and quality of life. That usually is what we're always constantly managing, risk and benefit. And when the benefit is significant enough that we feel like it outweighs the risk, that's when we make that decision that this is a
Jason,
treatment.
Before we go to a break, because we're going to go to a break now, what would you want to add in as the attorney for E-Pain on that subject?
Just that we take very serious the idea of identifying the correct patient for this type of treatment, and that we really do marshal all the resources available to us to make sure that the patient is taking the medication in the safest possible way.
So, I think that it's great that you're on here to talk about this, because, there's two sides to every story, right? And there might be, you're listening here, might be someone that you know that you might want to talk to someone. Maybe they're in a situation where they are going to go get surgery or whatever, and they may not even necessarily want to do that. Maybe you want to try and find out something that they get a second opinion on. They're here to talk to you. They do free phone consultations. They do telemedicine. They also follow up with video conferences. Their phone number to call direct, it's 480-559-3149. Their website is e-pain.net. There are two sides to every story, and we're going to go to a break, and when we come back, we're going to talk further. Hang tight. We'll be back in just a minute. Welcome back, everyone. We're talking with Scott Whiffenden. How to say it? Whiffenden. And he's the owner of ePain. It's not easy, guys. I also have with me Jason Chapman, and he's the attorney with ePain. We've been talking at the break, and I've been asking you, maybe we should open up the audience and find out what other people might want to say about this. So we are. I'm going to do that. Because sometimes you might have an opinion about something, and they deal with it all day long, right? You deal with it all day long. And there are two sides to every story, and they want to be able to explain to you why sometimes these drugs that they use for people in the right way are right for certain people. Not everybody, but certain people. So we're going to open up the lines first for that. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. I'm going to do it this way. I'm going to let you call in. Maybe you are taking opioids. Maybe you are. Maybe you want to tell us how great they are for you. Okay? Maybe you have somebody that you want to talk about that maybe was addicted to them. Okay? Whatever your thoughts are about it, we're going to let you open up the lines here and call in if you want to talk. Our number here is 602-277-5369, and toll free, it's 1-866-536-1100. Okay, so when we were talking at the break, I asked you, what's the number one when somebody, you say you deal with these questions all of the time, and it's not really a question, but when they attack you about the things that you do. Is that the right way to say that? I don't know.
Sure.
Okay, because you get attacked sometimes because of what you do.
Yeah.
Okay, let's talk about that.
Well, yeah, the risk with this medication is the addiction piece, and there's a risk of that. And for anybody who's known a family or friend who's been addicted, it's a terrible thing. And because of that, they tend to not support this medication, because a lot of addiction starts with the use of prescription medication. There's a genetic factor, there's a behavioral factor, there's all kind of factors that lead to addiction, even when you're trying to use this medication properly. And so to reduce that risk, a lot of people think we should stop this entirely. That's one side of the coin. Reduce the risk by stopping its use or reducing its use. For those people who take it appropriately and properly and don't have a problem with control, this is sometimes, for many of them, their one lifeline to a quality of life that they really want. So the other side of the coin is, why should I be punished if I haven't done anything wrong, and this gives me an ability to work, it gives me ability to interact with my grandkids, and it doesn't produce the negative harms of addiction for that patient.
I think some people think that you could take it one or two times and that's it, you're addicted. Is that true?
There's a genetic component, yeah, and it doesn't take long. The state has done a great job in limiting the initial doses for patients that have not been on this before to 5 days. And they're trying to keep patients from getting on it for too long a period of time and running a greater risk of addiction.
You screen your patients firsthand, and you're going to find out exactly whether or not, if they already are an addictive type of person, because really that's where it starts, right? You can get addicted to anything, okay? Ding-dongs, right? I think my ex-husband is. I mean, seriously. So you can get addicted to almost anything if you have that personality in the first place, right?
That plays a role, yeah. Mm-hmm. But a ding-dong addiction usually doesn't lead to respiratory depression and death like opioids.
You could get pretty big from eating ding-dongs every day and have a heart attack, right? I mean, I'm just being funny right now, but serious. But for what you do, you're saying that for you, they're derogatory towards you. How does it work? What happens?
No, they just question our intent. They question the outcomes, and so, that's usually what we deal with. Is the risk of the addiction, is the risk of the problem worth the potential benefit that is there? So
I'm looking at what you do to keep them safe, the patient safe, that you put them on this. First of all, you're doing a psychology, pathology, exam. It's a screening.
Yeah, we have to screen for a lot of things. We screen for depression, we screen for anxiety, we screen for substance use disorders, we screen for functional limitations. So we try to get a global picture of what the limitations and risks are for a patient before we decide whether they should be on this type of medication. So there's, the recommendations, the guidelines that are out there are very good if we will follow them at helping us pick the right patient, helping us monitor the right patient, which will help us, we hope, protect patients from the addiction that is, so rampant out there and that everybody's so worried about.
Right. Well, we have our lines open here if you want to call in and tell us about, maybe you're on it, maybe you're not, maybe you know somebody that is, maybe you have I don't know, maybe you want to talk about the fact of what your thoughts are about it. We want to let you open up the lines to the audience for us to be able to do that. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. And if you call at the break, I'm going to let you guys get connected with everybody after, after the show or over the weekend, okay? Sure. So, what is the hardest part about being a chronic patient, pain patient on their end?
I think the first thing is that chronic pain never leaves you. It follows you to work. It follows you to play. Wherever you go, it's with you. And that can be fatiguing, and it can be very difficult to manage. I think that's one of them. I think there's a couple of things that chronic pain patients really deal with that they struggle with. The other is the stereotype that is associated with it. When you take prescription opioids, I think a lot of times our society crumbles that right in with illicit opioid use. And so a lot of patients become embarrassed that they need this. They're embarrassed that they may consider themselves an addict, which then makes it hard to pursue or continue treatment. So I think there's a lot of things that make being a chronic pain patient difficult. Again,
with what you do, though, once you have put them on this particular drug, then what? How you follow up? Tell them how you follow up with them. You're making sure that you're going to do everything in your power to make sure that they're not getting addicted.
Sure. We see them on a once-a-month basis. We, again, follow up with their pharmacist to make sure, what they're getting there. We do a drug screen which tells us what they're taking. We can confirm that they're taking what we give them. We can confirm that they're not taking things they shouldn't be. We call family members. We try to get family involved in this type of care because often family support is such a big thing. And we, count their pills, make sure they're taking them at the right rate and not overtaking them. And so we have some processes that help us protect patients.
So what is the message that ePain has for chronic pain sufferers in the Phoenix area?
We strive to treat these patients with respect. We try to honor and recognize their condition. We try to give them the care that they need so that they can function. And our biggest thing is that we're trying to protect them. And so that's kind of our big goals there.
Well, I'm going to let you chime in and anything that you want to add to this.
Yeah. I can just say that having observed it and how our providers treat the patients, that's the biggest thing, is that the system that we've set up allows the providers to treat the patients with respect like human beings, because the system is set up to give the providers the information that they need to ensure that the patients are taking the medication safely. So our providers don't have to guess. We know if they're taking them safely or not. And if they're not taking them safely, then the providers will work with them.
Your patients, when they come in, and they've been now working with them, what do they say to you? You've taken them from the life of, they feel like they have no life now. They might as well just die right on the couch, right? To now they have a life. What do you hear from your patients?
Thank you.
Yeah, a lot of them are grateful for the opportunity to have the treatment. It doesn't solve all their problems, obviously, but in most cases, it gives them an ability to do things that they otherwise would not.
So for all of the people that are going to say, well, it's just masking the issue.
And that's exactly right. But for someone who can't get out of bed, masking the issue can make all the difference in the world. And I think that's what we're trying to do. And I think people that aren't in chronic pain struggle to understand the fact that when you're in that kind of discomfort and there's no traditional option for you, this can be a lifesaver.
Let's say there's no traditional right? But you've put them on that, and is there a way that, do you also wean them off? Do they, help them so that they also can get off of it too? Or do they, once they're on it, they're on it?
Yeah, we strive on an annual basis to try to taper our patients off their medication. So those that tolerate that taper, those that can handle it, we do that, and I think they're in a much better place when we do. That's not for everybody. Not everybody can tolerate that kind of thing, but our policies, our procedures are to attempt that annually.
Well, here's the other side of the story right here, and they're going to be coming back again. They're going to be talking a little bit about it. They do want to get the word out about this, and to make everybody understand, that's what it is. It's an education here about this. They are located in Mesa on Alma School and Baseline. They work They will do telemedicine with you. They do follow-ups with video conferences. They do free phone consultations. Their phone number, it's 480-559-3149. It's e-pain.net.